more folks are planning to join and may trickle in. But I am just super excited to introduce Dr. Allison Lippy, who is going to be speaking with us today. Hi, Allison, about managing youth with anxiety in the context of COVID-19. And just by way of introduction, so Dr. Libby completed her undergraduate at UCLA and her PsyD through the Stanford PsyD Consortium, and she completed her training, her internship at Children's Oakland, and then her postdoctoral fellowship at Kaiser South San Francisco. And she specializes in the treatment of youth with anxiety and OCD, in particular in the areas of exposure and response prevention. And so with that, I will let Allison take it from here. And just in terms of housekeeping, if folks have questions, to please feel free to use the chat feature and send those questions in, and then we'll have some time for Q&A at the end.
Great, thank you, Petra. So yeah, my plan for us today is for me to talk for about 45 minutes and to leave about 10 minutes for the end for questions. So I'm gonna start sharing my presentation with you. Okay, so hopefully you can all see that. I'm gonna put my chat up, so if for some reason you cannot see the presentation, then please just let me know. Okay. So I'm a psychologist at Langley Porter, and my email address is allison.libby@ucsf.edu. So if you have any follow-up questions, send them my way. I'm happy to consult at any time. Okay, so our agenda for today is we're going to be talking about the difference between stress and anxiety. And what is clinical anxiety? When do we know that we want to be intervening in the youth that we are working with? And then the main component of my talk today is what can you do as you're working with youth that are anxious, that are dealing with this crazy time of being in shelter in place and the stress and anxiety that comes with COVID-19. What can you do with brief interventions and how you can help coach parents? And then I'll also be briefly talking about referrals and resources, and we'll leave some time for questions. Okay, so the difference between stress and anxiety and clinical anxiety. So everybody on this chat right here has experienced some level of these things. We all have stress, especially now. So stress is a response to a situational stressor, and our response goes away when that stressor is removed. So I have a couple examples here. So when we're thinking about the kids that we see, a lot of them right now are in the middle of taking finals. So a lot of them have stress in response to those finals. The finals are happening now or next week. They're preparing and they might be worrying about those finals and stressing out about them. Another example of stress in response to a situational stressor is, let's say somebody is in a grocery store, it's a little bit crowded, and somebody near them coughs, and they might have a worry of, oh no, does that person have coronavirus? So stress is a response to a real stressor that's happening. Anxiety is a response that's present when the stressor is not immediately present. So a lot of anxiety is about the future. It could be the near future or it could be the distant future. So an example would be if a teen is worrying about their homework load for the next school year, what that's going to be like. It's not the next school year yet, so this is not an immediate stressor, but it's something that's more distal. Another example would be worrying about a parent getting sick and dying despite no current health issues or no COVID in the family. So the difference between stress and anxiety is whether or not that stressor is currently present. With anxiety, we continue to worry even though the stressor is not immediately there. Clinical anxiety is all of the above, plus functional impairment and or significant distress. So whenever we're trying to figure out, does this kid meet criteria for an anxiety disorder, we're always looking at those two things, functional impairment or significant distress. So how is this worry getting in the way of this child's life? Are they not able to participate in school or do homework the way that they would like or need to? Is it interfering with family relationships, with self-care such as sleep or eating? Is it interfering with their ability to socialize as best as they can, given our current social shelter-in-place situation? In what ways is this worry and the anxiety interfering? Or is it causing significant distress? Is this very bothersome? Does the child have a very hard time controlling the worry and is bothered by it? We can have a super anxious kid that's functioning great and isn't that bothered by the worry, in which case we wouldn't call it clinical anxiety. So of course, there are things that we can do to intervene with anxiety, but we really want to be intervening when we see clinical anxiety, when there's functional impairment and or significant distress. So let's talk about normal, and I have that in quotation marks because, as you probably have heard, that psychologists and psychiatrists don't like the word normal. What does normal even mean? But of course, we're thinking about what can be considered kind of the norm right now in this current situation. Stress and anxiety are very normal right now. Of course, this is a really weird situation. None of us have ever experienced anything like this, and we know that uncertainty and feeling out of control are significant contributors to feelings of stress and anxiety. Super normal right now. Our kids and teens that we see are going to be experiencing some level of stress and anxiety right now. But we want to normalize that for them. We want to tell them that that's okay and that we're all going through it together. Also, productivity and expectations have or should have changed. This means that we cannot have the same expectations for ourselves that we did in February or January, and that's okay. So I work with a lot of kids that have been struggling with school since being at home. It's been challenging for them to self-regulate and not procrastinate and get all of their work done. That's okay. This is weird. No one's been trained to be able to do this, and so everyone is struggling to some degree, and it's okay right now that we are not as productive as we have been in the past when we had a normal life. As I mentioned before, we are immersed in uncertainty and lack of control. We're not really sure what's going to happen for school in the fall. We're not sure what the summer is going to look like. We're not sure when we'll be able to see our friends. Uncertainty and lack of control lead to experiences of anxiety. One thing that we can do, which I'll talk about later today, is kind of lean into those feelings and accept them. It's also important to teach kids and teens that there are no wrong feelings. All feelings are valid, and we usually experience a range of feelings, sometimes all at the same time. So for instance, right at this moment, a teen could be feeling anxious, they could be feeling excited that school's almost over, they could be feeling sad that they don't get to experience the end of the school year with their friends. There could be so many different feelings happening, and those are all okay. There are no bad feelings. This is also a constantly changing experience, that week to week and even sometimes day to day, we are handling this situation differently. And that's certainly been the case with what I've seen with the families that I've been working with, is that there's just kind of been a roller coaster of emotions and ability to cope. All of this is normal. All of this is perfectly okay. So just labeling that oftentimes is really helpful for kids and teens. Sometimes they expect adults to kind of have things all together, and even parents might pretend to have it all together and to not be stressed and try to hide it from their kids in order to shelter them. But that's actually not helpful, right? We want to be honest that we all have emotions and that it's okay to be stressed and anxious. And what's more important is how we handle that. We want to be good role models at managing our stress and anxiety appropriately. Okay, I'm going to briefly talk about the cycle of anxiety, but I'm not going to get into it too much. So anxiety always starts with some sort of trigger. So potentially, thinking about coming into contact with somebody in the public. That could be a trigger that leads to thoughts such as, I could get COVID and spread it to my family. The trigger also leads to physical sensations. So when we get anxious, our heart beats faster. We might start to breathe a little more fast and shallow. We might start to get shaky or dizzy or nauseous. And the combination of the thoughts and the physical experiences create our emotion of anxiety. So anxiety, like other emotions, we can feel in our body. So when we're angry, we've got those physical sensations. Maybe we feel hot. Maybe our chests get tight. When we're sad, sometimes we get a sinking sensation. We might feel kind of numb. So similarly, anxiety, we feel it in our body, but because of our fight, flight, freeze response, we can feel it more intensely. It's a very uncomfortable emotion. So I'm sure you all know about the fight, flight, freeze response, but just briefly to touch on it, it's our evolutionary response that we have in terms of danger. And of course, our brains didn't really evolve to face anxiety. They evolved to face life and death situations. And so when we're faced with things that are stressful, our brains react immediately to release cortisol and adrenaline. And that causes the fight, flight, freeze response that we need when we're actually faced with life or death situations. We don't need that response when we're faced with things that are just anxiety producing, such as giving a speech or taking a test, but our brains react in the same way. So it's a very strong, intense physical response, and it can range all the way from, mildly increased heartbeat to an immediate panic response that's a flooding of these physical sensations. Either way, it's uncomfortable and we don't like it. So we are motivated to get rid of our anxiety. And two ways that we try to do that are by avoidance or escape, and by reassurance, which can also take the form of checking. If we're anxious about something, we tend to try to avoid thinking about that thing or facing that thing, and that is a way that we try to get rid of the anxiety in the moment. Or we may try to go the other way and ask for a lot of reassurance about that thing. So for instance, kids and teens might be asking lots of reassurance-seeking questions. Is this going to be okay? Is anyone going to get sick? What will happen if one of us gets sick? And they may also engage in some checking. So for instance, let's say when somebody has a parent who is an essential worker and is off at work a lot, that kid might be texting their parent all the time, checking in, how are you feeling, where are you, things like that. So the avoidance and the reassurance seeking, both of those things serve to get rid of anxiety in the moment, but ultimately only contribute to the cycle of anxiety, creating a negative reinforcement cycle so that the next time the trigger comes up or the anxious thought comes up, the avoidance and reassurance are more likely to happen again. So it just spirals out of control when we do those things. Okay, so I oftentimes ask kids, is anxiety good or bad? And almost always they say, it's bad. And I say, haha, that was a trick question. Because anxiety is just an emotion. It's not really good or bad. It could be helpful in some circumstances. It could be very unhelpful in some circumstances. Ultimately, it's just an emotion. And so it's not really good or bad. It just is, just like any other emotion. It just feels uncomfortable. When we think of clinical anxiety, I like to teach kids and teens that it's like a broken smoke detector. So if we think of the purpose of a smoke detector, it's to alert us when there could be danger, right? Where there's smoke, there could be fire, and we need to protect ourselves. But let's pretend you have an overly sensitive smoke detector where any little particle of something in the air sets it off. That means the smoke detector is constantly saying there could be danger, there could be danger. And you never know when it is real danger and when it's a false alarm. So clinical anxiety is like that broken smoke detector. The alarm is constantly going off saying, this could be really scary, pay attention to this, do something about it, when most of the time it's a false alarm. So really briefly, the types of clinical anxiety that we see in kids and teens are generalized anxiety disorder, which is excessive worry that's difficult to control about different areas of life for much of the time for most days. So these would be worries that most of us have, worries about things like their grades or the future, worries about getting sick, worries about their family's safety, worries about finances, all of these things that most people worry about, but in clinical GAD, it's excessive worry that's difficult to control for much of the time. And of course, there's social anxiety. An interesting thing that's happened during the shelter in place is that for many kids, their social anxiety has improved because there's no situations to push them, which would make them anxious. So we are going to expect that as things open up, and if and when kids go back to school, say in the fall, social anxiety might come roaring back. So we have to kind of take a look out for that. Specific phobia, anxiety is about specific things such as a needle phobia, claustrophobia. Separation anxiety, anxiety being away from parents. Kids that already have been experiencing separation anxiety tend to be more anxious right now because they're a bit more worried about their families and maybe having a harder time being away from parents. And then we've got this kind of catch-all category of disorder otherwise specified, which is when the anxiety does not meet criteria for any of the above disorders, So if you have a kid that's like pretty much just anxious about this COVID situation, we would call that an anxiety disorder, otherwise specified. It's kind of like generalized anxiety disorder, but it's not in multiple categories. It's really just the worry about kind of safety and health of themselves and their families. So there are several disorders that are common comorbidities for anxiety disorders. So the most common disorder to have if you have one anxiety disorder is another anxiety disorder. So kids who are already anxious, say, let's say they have social anxiety, they might be super anxious right now about coronavirus. Maybe not, but it's more likely to have another anxiety disorder if you have one. Other common comorbidities are depression, and then a little bit less common, but still co-occur quite frequently, are ADHD and learning differences. Okay, so now let's get into the meat of it. What can you do? If you are working with a kid or teen that you have found to be quite anxious during this time, what are the things that you can do briefly to try to intervene? The things that we'll cover today are assessing functional impairment and distress, which we've already talked about, right? That's how we know if there's clinical anxiety when we want to do something about it. You can teach brief skills to the kids and teens and their parents, and coach parents on what they can do at home. You can provide referrals and resources, and then of course you could consider medication as well. I am not a psychiatrist. I do not prescribe medication, so if you have medication questions, then I would recommend consulting with one of your psychiatry colleagues. But I did want to just briefly mention a couple things. One is that, as I'm sure you know, that medication does not cause lasting impact in terms of our ability to handle stress. So that means while taking medication in the moment could relieve some anxiety, once we taper off that medication, we're not going to expect any lasting effect. So we really want to be considering when to pair medication with therapy. And we've got a lot of research on cognitive behavioral therapy, which is the type of therapy that I do. And of course, there's many other types of evidence-based therapies out there that work for anxiety. And so having therapy on board is going to be the best way to ensure kind of lasting ability to manage anxiety over time, even if the child goes off medication in the future. And then again, I'm not an expert on medication, but just really quickly wanted to talk a little bit about benzodiazepines because those are sometimes prescribed for anxiety. All of the psychiatrists that I've worked with have mentioned that they very rarely prescribe these to kids and teens for a few different reasons. But one of them being that we have some research to show that therapy actually doesn't work very well while someone is on a benzodiazepine. So while a benzodiazepine might be effective in the moment for managing anxiety symptoms, it doesn't help to create a lasting effect, and that the benefits of therapy could actually be tampered down a little bit if someone is concurrently on a benzo. Okay, so here are the skills that we're going to go over today that you can briefly teach to the youth that you work with. Scheduling, behavioral activation, TIPP and relaxation skills, cognitive skills like checking the facts, and sleep hygiene. So the skills that I've listed here are all designed to be discussed very briefly. So even if you only have, say, 10, 20 minutes in an appointment, there are still some of these brief things that you can share with kids and teens. And at the end of the presentation, I'm going to also be covering resources, but one of the resources that we have at Langley Porter is like a COVID resource webpage, and it's very extensive. It has a lot of great things about most of these things that I'm going to be covering today. So you can also just give out that website as a resource, which can be really helpful. Okay, so let's talk about scheduling. This is going to be so important for kids and teens, even more so now that school is ending and there is no structure in these kids' lives. Whereas in the past, they've been used to being very scheduled, having a set school schedule, oftentimes having after-school activities. And this is the same for Monday through Friday. Even in the summer, a lot of times kids have camps or other activities that they're doing. And right now we're kind of in a scheduling free-for-all. This is going to be an area that could really cause a lot of anxiety if kids and parents don't create their own schedules. So by having a schedule, it helps build a sense of control, and that's going to improve anxiety and mood. And it also helps regulate sleep. So when kids, and especially teens, don't have a schedule, their sleep schedule tends to get totally off. Especially in the summer, they start going to sleep later and later, and they can actually kind of flip their circadian rhythm and become a little bit nocturnal, which we don't want. It's helpful to have a morning and nighttime routine to kind of set the stage and bookend each day. It helps us feel kind of calmer and more in control, and also helps our circadian rhythm. It's also important to have flexibility in a schedule. So I don't want kids that are kind of scheduling every 30 minutes certain things and they have to stick to that schedule. We want to watch out for all or nothing thinking, which is if a kid doesn't stick to the exact schedule, they might say, well, this is terrible. I've done a terrible job today. I might as well give up for the day. I'll try again tomorrow. We don't want to think that way. We want to have some flexibility, have kind of a loose but structured schedule, and do the best that we can to stick to it, while at the same time recognizing that we can shift and change if we need to throughout the day. Oftentimes with the kids and teens that I've worked with at the start of shelter in place, we got the parents on board and we wrote down a loose schedule of what they can expect Monday through Friday in terms of what their morning routine is, a couple hours in the morning to do schoolwork. Sometimes they even had kind of set ideas of I want to work on history and then math, but again, that can be flexible. Then they have creative time, exercise time, fun time, and then, meals and nighttime wind down routine. So having a written schedule is important. So behavioral activation is a tool that we oftentimes use for depression, but it's super helpful for anxiety too. And I think it's even more important to be thinking about now when there are so many activities that kids can't be doing. There are also a ton of activities that kids can be doing. So behavioral activation is all about pushing ourselves to be active and productive and do things, even if our mood does not agree with that. So sometimes our mood says, stay in bed all day, I don't feel like doing anything. That's not going to help our mood in the long run. So we want to be scheduling these activities, pushing ourselves to be doing things. So behavioral activation improves mood, decreases anxiety. It's important to break tasks down into small steps, especially if people are feeling low motivation to do things. So for instance, as I mentioned before, lots of kids right now are in finals and doing all kinds of projects and wrapping up their school year. And if they think of all the schoolwork they have to do, they might get quite anxious and quite overwhelmed. Instead, we want them to break down each assignment into different little chunks of things. So just yesterday, I was working with a teen who was feeling anxious about a math assignment. And I said, okay, what's the first step? Open the math book. How hard do you think opening the math book will be from 1 to 10? And then I'm going to have you do it. Open up the math book. Okay, now how hard was it actually from 1 to 10? So my teen predicted that it would be a 4. It was actually a 0, not hard at all. And we just go step by step by step. And that's going to help us kind of keep going, even if we don't have a lot of motivation to tackle the entire task. 4 important areas of activities to think about. I mentioned we want to be productive, but the word productive does not necessarily mean what it meant several months ago. So it doesn't just mean doing schoolwork. The 4 areas of productivity are fun and enjoyment. So this could really be anything that the kid enjoys. Building mastery. So working on a type of skill where a kid could feel like they are getting better and building that skill, like learning a language, learning how to dance, practicing a musical instrument, baking, could be all kinds of things. Self-care. So that an activity for self-care could be taking a bath or shower, having a cup of tea, doing a face mask, putting on some lotion, organizing the closet, and then helping others. So what is a nice thing that the kid or teen could do for a family member or a friend, or maybe even a pet? So those 4 areas of activities can help kids and teens kind of think about how they want to structure their day. And when they really run out of ideas, they could create whole lists of these different areas. So that brings me to goal-directed versus mood-directed behaviors. When we are anxious and sad, oftentimes we don't want to do much. So at the top, you can see that when we have mood-directed behaviors, we let our moods dictate what we do, the actions that we take. So if we're feeling happy, maybe we'll go take a hike. But if we're feeling anxious and grumpy, maybe we just kind of stay in bed and don't do anything. Ultimately, mood-directed behaviors are not going to be helpful. This comes a lot when kids say, well, I'm just not motivated to do that. Like, okay, That's okay. You don't have to be motivated in order to do something. I was not motivated to wake up when my alarm went off this morning, and I did it anyway. So rather than focusing on mood-directed behaviors, we want to focus on goal-directed behaviors. This means taking action based on what our goal is, regardless of our mood. And we all do it all the time, just like getting up early in the morning, or going to the dentist, or exercising. Just because we don't feel like it doesn't mean we can't do it. So with goal-directed behaviors, we take the action that's consistent with our goal, regardless of our mood. This is going to be particularly important if you have an anxious youth who is avoiding things due to their anxiety. And so if they're, avoiding schoolwork or avoiding talking to friends, we want to make sure that they think about what are your goals and can we help push you to take actions that are consistent with those goals. Okay. So here are some emotion regulation and body regulation strategies that you can briefly teach the youth that you work with. The first one, and one that seems so super obvious, but that kids and teens don't do it, and actually adults don't often do it, is labeling our emotions out loud or writing it down. We feel very overwhelmed. We might not even be truly in touch with how we're really feeling. And so by specifically naming the emotion, that can actually be enough to help us feel a little bit better. One, it's because we're validating that emotion, but two, it actually kind of changes some of the neurobiology in our brains that takes the emotion kind of out of the hippocampus and puts it more on the frontal lobes. So you could kind of teach a kid this, and you could say, right now, how are you feeling? Maybe it's more than one thing. I really like to use feeling wheels. You might have seen those, where they kind of look like bullseyes, and each circle kind of gets more and more specific of the emotions. So in the center, there's like anger and sadness and anxiety and happiness and peacefulness. And then as you go out in the circle, they get more specific. I really love feeling wheels because it can be very helpful for kids and teens to be able to kind of point and label their emotions. Okay, so TIPP skills, TIPP. These are often taught in DBT, dialectical behavior therapy, but I think that these skills are so helpful because they're very quick. You can do them anywhere, anytime, and they can really help kind of regulate our body when we're faced with anxiety and when we have those body symptoms that come with anxiety. So the T is temperature. They're kind of shocking the system. This could mean holding ice or putting an ice pack on our forehead, taking a hot or cold shower, kind of briefly just shocking the system, can kind of change our anxiety experience in the body. Intense exercise. This could just be really brief, like a minute or two, but running in place, doing jumping jacks, doing burpees just for a minute might be enough to kind of get some of those stress chemicals more regulated in our body. Paced breathing. So what we want is we want a longer exhale than inhale. We want a long inhale, but an even longer exhale. As I'm sure you know, when people are anxious, they start to breathe faster, sometimes even hyperventilating. And so the inhale is kind of deeper than the exhale. We want the opposite of that. We want slow inhale, but really long exhale. That's going to slow the heart rate down, trigger the parasympathetic limbic system, and overall help us feel more relaxed and calm. So we want to be breathing through our belly, through our diaphragm, rather than up here in our chest. Nice deep belly breaths. I often like to tell kids and teens, think of a balloon as your belly. So your belly is the balloon, and as you breathe in, the balloon inflates. As you breathe out, the balloon deflates. And we can have them practice by putting one hand on their chest, one hand on their belly, and really focusing on that lower hand movement. And then breathing in for a certain number of counts and exhaling for longer. So common one is breathing in for 4 counts, holding for 6, exhaling for 8. I really like that one, but it doesn't have to be like that. You could try breathing in for 5 and exhaling for 7. It's really just what is best for this kid and teen, and they can kind of play around with it and see what they like. And then once they find the way of breathing that they like, they can keep practicing that, as long as the exhale is slower than the inhale and it feels regulated. The last P is progressive muscle relaxation, which is a great relaxation strategy that involves tensing and releasing muscles systematically. If you go to YouTube and type in progressive muscle relaxation, there are a ton of videos that can lead you through how to do this. And so this is such an easy skill to tell a kid, because you just say, you write down progressive muscle relaxation and say, go to YouTube, look it up, try some things out. It only takes 5 seconds to be able to share this skill with them, and then they can go do it on their own. Some other relaxation skills to use. Mind vacation. This is a visualization skill where you imagine yourself in a very comfortable, safe place, and you think about how it would impact all the senses. So right now, I would love to be on a tropical beach in Hawaii, and I would see the sun and the sand and the waves, and I could hear the waves and the breeze moving through the trees. I could smell the ocean. Maybe it also smells kind of like pineapple, tropical fruit smells. And I can feel the sun on my skin and the warmth of the sand under my toes. Maybe I'm even drinking some pineapple juice. It would be sweet and tangy. So kids and teens can pick any place, real or imaginary, where they want to take their mind vacation and just take a couple minutes out of their day to pause, think about this place and how it would impact all the senses. Speaking of the senses, soothing the senses in general is such a helpful mindfulness and relaxation strategy. So we can think about ways that each sense can be soothed, and we can also combine them. So for instance, I love to drink tea in the morning, and I like it because the cup feels hot on my hand, but I can also kind of smell the herbal notes of the tea, and it has a very soothing flavor. So multiple senses all at once. There's a really nice grounding exercise of 5, 4, 3, 2, 1. So that is looking around and thinking 5 things that you can see around you and labeling each of the 5 things. 4 things that you can touch, touching those 4 things and noticing the texture. 3 things that you can hear. What sounds do you hear in the room, out of the room, inside your body? 2 things that you can smell. So maybe there's not kind of an ambient smell, but certainly I can smell the laundry smell, or I can smell a lotion that I have nearby, or I can smell the tea that I'm drinking. And then 1 thing that you can taste. So what's 1 thing that maybe you can pop in your mouth like a mint and taste, or is there anything else that you can taste, or is there a lingering sensation of taste from your last meal? Warm places. So oftentimes when we get stressed, our blood vessels constrict in our hands, and we actually want kind of nice, open blood vessels. And so thinking about warm places can actually help that happen, right? We have such a strong mind-body connection, and there's actually some really cool biofeedback research that shows that people that practice imagining warm and cold places can actually change the temperature in their hands. When we are relaxed, our hands are warmer, and so we want to use some visualization strategies to imagine ourselves in warm places, like being in front of a fire, being in a really nice cozy bed, lying in the sun, things like that. And then one other relaxation skill that I really like is autogenic relaxation. You can also Google this, but it's a relaxation strategy that helps people fall asleep, but also just really helps kind of kick off that parasympathetic limbic system and really helps our body relax. So it's something that could be used at any time. And it's essentially kind of training ourselves to imagine that our body is feeling more relaxed. And then in imagining that, we can actually make it happen. So autogenic relaxation oftentimes involves imagining that our arms feel warm, that our arms feel heavy, that our breathing is very calm, that our heartbeat is slow and steady, things like that. So if you Google that, you will find the words to that. So all of these skills that I just mentioned are skills that are so brief and so easy to teach that it's something that you could do for a really brief intervention, even if you only have a few minutes with a kid. Okay, so let's talk a little bit about screens. I bet we all have screen fatigue. We have been on screens so much lately, and kids are too. They currently are a necessity because of school. There are ways for social connection, and even a lot of the activities that kids are doing. Like I know kids who are taking dance classes through Zoom or are learning how to play musical instruments via video, constantly on screens. That's a necessity, but we also want to be watching it because research shows that screens, and in particular social media, are associated with increased depression, anxiety, and sleep problems. So this is tricky, right? Is that we need screens right now, and a lot of times social media is kind of like one of the main ways that kids are connecting with each other, and we want to regulate that. So this is important to talk to teens and parents about, is that we need to take breaks from screens. We need to go outside. We need to be active in ways that don't involve screens. And our youth are not very motivated to self-regulate, so we really do have to involve the parents. It is very helpful to have phone curfews where the phones get taken away. And even some teens will be willing to experiment, right? So if you just say, just try for a day, or just try for 2 days, just try for a couple hours, where you take a social media vacation and rate your mood and your level of anxiety before and then after. And almost always, the teen realizes that actually they feel pretty good after they've taken their social media vacation. So it's helpful to couch it as an experiment, like a challenge, right? Just try this challenge, just try it for a day, see how it goes. Okay, sleep hygiene. So sleep right now is super disrupted for a lot of kids because they don't have to get up at the same time the way that they used to. And so it is really important, again, to talk to kids and families about scheduling. And here are some important tips for helping manage sleep. As we all know, it's so important to get good sleep because it really does help with anxiety. When we are sleep deprived, we are more anxious. And then when we're more anxious, we have a harder time falling and staying asleep. So here are some do's. Have a nighttime routine. We want to have a similar routine each night to get our brain in the mode of going to sleep. Maybe that's a couple minutes of stretching, brushing my teeth, washing my face, 5 minutes of maybe putting on lotion or yoga, maybe 20 minutes of reading, and then I try to go to sleep. We want to have kind of a consistent nighttime routine, help our brains wind down. We also want to have consistent sleep and wake times. This is challenging now, again, because most kids don't have to get up at a certain time, and so it really is important to discuss with the parents, like how can we kind of keep monitoring this. And we want generally consistent sleep-wake times, whether it's a weekday or a weekend. And then, of course, we want to be thinking about this over the summer when schedules just kind of go all crazy. We want to be winding down several hours before bed. So this means setting up blue light blockers or nighttime modes on our electronics. We want to be dimming the lights, getting our brains in nighttime mode. We want to get good exercise during the day, and we want to keep a pen and paper by the bed for our worry thoughts. So oftentimes we're kept awake by worries, and we want to be able to just like quickly jot them down and say, I can worry about this tomorrow. Now is a time for sleep. Some don'ts are, don't watch the clock. That's never helpful, especially when we start calculating how many hours of sleep we'll get. So instead of watching the clock, the teen can tell themselves, you know what, I've been sleep deprived before, I've been okay. So no matter how much sleep I get, I'll be able to handle it in the morning. To not do activities in bed. So we don't want the teens to be doing homework, watching TV, reading in bed. We want to do those someplace else so that bed is just reserved for sleep. That way our brains can associate bed with being asleep. We don't want to lie in bed awake for long stretches of time because, again, that makes our brains associate bed with being awake. So if we've tried to fall asleep for 15 to 20 minutes and it hasn't worked, we want to get out of bed, do an activity for a few minutes, a calming activity, not involving screens, before getting back and trying again. We also don't want to have caffeine past noon, and naps, of course, we know interfere with our circadian rhythm. Okay, I realize that I only have about 5 or 6 minutes left, so I'm going to cover this and then kind of quickly talk about helping coach parents. So checking the facts is a very helpful cognitive strategy when managing anxiety. So something that happens with anxiety is called overestimation of threat. So this means that anxiety makes us overestimate the likelihood of a bad thing. So if I ask an anxious teen, what do you think the likelihood is that you will die from coronavirus? That teen might say 40%. And I would say, nope, let's check the facts. Anxiety makes us overestimate the likelihood of this bad thing. So one way to check the facts, there's actually a website I found, the 19andMe Mathematica website. It's a COVID risk calculator. So you type in your age and your zip code, whether you have underlying medical conditions, et cetera, and it kind of puts out the statistical likelihood that you will get coronavirus and the statistical likelihood that you will be hospitalized, be in the ICU, or die. And of course, we know for kids and teens, these things are extremely unlikely. But even for older adults, if we're trying to be safe, wearing our masks, sheltering in place whenever possible, the risk is still really low. And so by kind of checking the facts on this, sometimes that helps with the anxiety. We always want to be taking a look at helpful versus unhelpful thoughts. Just because we have an anxious thought does not mean that it is true. We really want to get this message across to kids and teens that we don't have to believe our thoughts. And we can change the way that we think to come up with more helpful and more accurate thoughts. We want to be checking the facts by examining the evidence that says the thought is true, examining the evidence that says the thought is false. So, for example, I had a kid recently worry that the shelter in place would go on for multiple years. Well, we don't really know what will happen, but let's examine the evidence for that. So evidence that says that that thought is true is that we don't have a specific end date, and there has been talk that school starting in the fall isn't going to look exactly the way that we're used to it looking. Evidence against that is that there are active vaccine trials happening right now, that lots of amazing doctors and scientists are working together on this, and that there are already some things opening up. ABC thinking is accurate, balanced, complete thoughts. So we want to be taking a look at our thoughts, asking ourselves, is this unhelpful and inaccurate? And if the answer is yes to one of those questions, changing the thought to be an ABC thought: accurate, balanced, complete. And an example of an anxious thought could mean, me and my family are going to get coronavirus and die. An ABC thought would be, my family and I are doing everything we can to stay safe. Even if someone in the family did get COVID-19, the chance that we would get seriously ill is very small. We will continue to do what we can. We're going to be okay. This is a pain and stressful, but we can handle it. Okay, so we want accurate, balanced, complete thinking, and the way to get there is by examining the evidence for our thoughts. We want to be sticking with facts and not feelings or opinions. So here are some steps. Number one is we want to write down the anxious thought. By writing things down, we can think about them more logically. They feel less true when we see them on a computer, on our phone, or on paper than when we're doing this in our heads. We write down the thought. We ask ourselves, is this helpful? Is this accurate? We evaluate the evidence, and we come up with a more helpful, more accurate thought. So right now we've got lots of uncertainty, don't have a lot of control about things in this world. We want to be accepting that we're uncertain, and that's okay. Uncertainty and loss of control are uncomfortable, but there's really nothing wrong with them other than that they are uncomfortable. When we have acceptance of that, when we kind of lean into it, we're better able to refocus on the things that are in our control. So right now, I can't control what's happening with the vaccine trials or what's happening with shelter in place. I can control what I do today and what I can do to take care of myself today. It's always helpful when we have an anxious thought to ask ourselves, is this a problem I can solve? If the answer is no, we accept it and we refocus on the things that are under our control. If the answer is yes, then we can problem solve. We want to use self-coaching statements like, I can handle this, and I've done hard things before. I've already gotten through the last few months and it's been challenging, but I've done it. And we want to be okay with discomfort. The more we accept it and practice it, the better we get at handling it. And finally, we want to limit our news exposure. There's so much out there that we can't control that going through all the little details of all the scary things that the news says is not helpful. This is especially true for kids and teens. Kids and teens don't need to know the news right now. They might just ruminate on it. We really want to be limiting that news exposure. So very quickly, because I want to make sure we leave time for questions, I'm going to go through working with parents. It's very important that parents validate their kids' emotions. So please do express this to the parents and teach them how to recognize that the way kids are feeling is totally okay. It's okay if they're angry. It's okay if they're anxious. It's what we do about it that's important. So we want parents to be asking kids, how are you feeling? And what questions do you have? And is there anything I can do to help? We want to be normalizing a range of emotion, that it's totally normal to feel anxious right now. It's totally normal to be angry. It's what we do about it and how we manage it that's important. We want to be modeling our own coping strategies for the kids. We want to be careful about reassurance. Like I mentioned in the beginning, reassurance sometimes can fuel the anxiety cycle. So we want to provide helpful reassurance, right? Like us as a family, we're doing everything that we can to stay safe. And like we're all going to be, we're young and we're healthy, so it's very likely we're going to be just fine. And we don't want to say something like it's impossible that we're going to get coronavirus, because we can't say that. We want to be honest. We can say it's so unlikely. It's not anything that you need to worry about. And we're doing whatever we can. We're going to focus on the things that are in our control. We also want to be careful with responding to reassurance-seeking questions. So if kids are frequently asking, are we going to get sick? What's going to happen? Are you going to be okay? When are you going to come home from work? I want parents to really try to hold back providing those reassurance answers and only respond once to any given question. The kid might continue to ask that question, and I want parents to say, you know what, this really sounds like you're worry talking. When we talked about this, I know that you can handle this. We want to label that worry, label the anxiety. It's so important for parents to be practicing good self-care right now. So there's that great metaphor that we have of we have to put the oxygen mask on ourselves first in an airplane before we can put it on someone else. Parents have to take good self-care for themselves right now, because otherwise they can't help their child correctly. And another metaphor is we can't pour from an empty glass. So as parents, we have to have our glasses at least half full, if not more than that, in order to provide good care for the kids. And we also want to emphasize effort, not outcome. School is winding down, so maybe this isn't entirely applicable in the summer, but a lot of times, a lot of parents and kids are focused on grades and test scores. We want them to focus on hard work and putting effort into things, regardless of the outcome. This is a weird time. You don't have access to your friends, you don't have access to your teachers, you don't have access to a distraction-free learning environment. As long as you're putting in the effort, that's what counts. Okay, so we do currently, if you have a kid or teen that has clinical anxiety, once you've assessed for functional impairment and level of distress, we do have a wait list at Langley Porter in my clinic, but it's shorter than it used to be, and we're doing video visits, so our wait list is open. The number is here. Some of these other places also have telehealth available, Child Mind Institute, Children's Health Council, and families can contact their insurance to see what else is available. And then some schools also have mental health counselors available for telehealth, although this might not be possible in the summer. And then here are some resource pages. So our own Department of Psychiatry COVID page is really great, totally lots of different skills to use. Stanford Children's Health has one too, and then 211.org. And finally, for books, these are a few books that I really like that are based on cognitive behavioral therapy principles. So for children, What to Do When You Worry Too Much is a great workbook. And then here are a couple workbooks for teens, the Anxiety Survival Guide and Anxiety Sucks. Okay, so I ended 4 minutes late, but I'm going to be okay with that because we're accepting the things that are hard to control. So now it's time for questions. So please either chat me or unmute yourself and let me know what questions you have.
Just while folks are maybe gathering their thoughts and thinking about questions, just wanted to thank you, Allison, for such a great presentation, and also to put out there that in the East Bay as well, that the Children's Hospital Oakland Mental Health Division is also accepting referrals, and there are community-based resources for folks insured with Medi-Cal as well.
That's great. And that one of the wonderful silver linings about right now is that there are so many providers around the country that can now see people we would not have been able to see before. So certainly if there's somebody in the East Bay, you know, anybody from my clinic in San Francisco could so easily see them over telehealth. And so it's great that there are so many different resources out there and that we can be kind of working together to find people services. I have a question about making the slides available. And so I'm happy to do that. Petra, would I just email the slideshow to you?
Yes, we are planning to both have the slide deck available, if that's okay with you, Allison, and then also to have a recording of this webinar on our website, which we should get up within the next week or so. So thank you.
Mm-hmm.
Yeah, I was curious about the exercises in particular, the things that you talked about that are sort of outside of our wheelhouse that I can never think of when I'm seeing these teenagers. So it would be great to get those specifically if you don't give us the whole talk. And
Sure.
Thank you.
Yeah, no problem.
One question that I have that's coming up with some frequency is parents worry about what things will look like for their kids who may have some social anxiety or who have more, significant generalized anxiety, and that these kids seem to actually be thriving more right now because they don't have the stress of their usual everyday lives, and so getting used to the situation as is, what things are going to be like for them maybe in transitioning back to school. Do you have any thoughts about that?
Sure. Yeah, it's a great question because it is complicated. And that's, I'm seeing that too, is that a lot of the kids with social anxiety and some kids with GAD are doing much better right now, just because those stressors aren't present. And so we really just want to explain to kids why that's happening, and that it's possible that that anxiety will get worse once life gets back to normal. We don't know that, right? We can't predict the future. So maybe this will be like a really great kind of pause, and that they'll feel better once things kind of get back to normal. But it's also possible that anxiety will kind of come roaring back. And so we just want to have that expectation that that's okay, and that might happen. In the meantime, we really have to get creative with ways to push kids and have them do exposures as best as we can. So while school still has been in place, a lot of kids have been having Zoom calls with their classes and teachers. And so at my socially anxious kids, I've been having them do exposures where they they put the camera on, they unmute themselves, they ask questions, they answer questions. They might initiate Zoom calls with friends, or give a friend a compliment. There are so many different ways that we can try to still be social and push the kids out of the comfort zone. And so we just have to get creative to think about ways to do that. With GAD, it's a little bit trickier because it kind of just depends. Some kids, once we switched to, a lot of the San Francisco schools switched to pass-fail rather than grades, and that just relieved a lot of the grade anxiety. And there's not a lot we can do to work on that over the summer. We kind of need some anxiety in place to work on it. And so we just have to think about, like, what are strategies where we can do exposures with these anxious situations. So for instance, one of my kids, I'm having him do some PSAT practice tests, not because I actually care about his PSAT score, but because it's a way to face the anxiety over the summer, while working on some of those relaxation strategies and the cognitive strategies. So we do the best that we can to kind of teach the skills we want them to use, get creative with exposures we can do, and also recognize that our hands are tied a little bit with what we can do right now.
That's great. Folks have other questions? I will selfishly proceed with another question. Another worry that is coming up with varying amounts of frequency is kind of, worry about grandparents, worry about people who are farther away or who may be having, significant health challenges. And so how to help manage that worry for kids right now, and or even siblings who may be hospitalized and they're not allowed to go and visit them, things like that.
Mm-hmm. Yeah, and that's hard. I think the very first thing to do is validate, right? Recognize that the emotions that they're feeling are real and reasonable, and that this is a really tough time. There's so much that's out of our control. If we can't visit a family member that's in the hospital, or we can't help grandpa that's across the country, and then of course we worry for our older adults too, since the risk is higher. So step one is we want to validate. And step two is we do want to check the facts, because sometimes while there are situations that can be dangerous, right? So like having a family member be very ill, there are also sometimes when our anxiety runs away with us. And so it's possible the anxiety might be overestimating the threat again. And so kind of checking the facts with that, seeing if it is possible our anxiety is overestimating it. And then thinking about what can we do, right? So a lot of these things are out of my control, but I want to refocus on the things that are in my control. I know my grandpa across the country really just wants me to be safe and well. So if I'm taking care of myself and using some good self-care strategies and letting my grandpa know that, I know that he's going to feel good. And I want him to do the same thing. And so by kind of modeling good self-care, that's going to be helpful to my loved ones too. So we want to be thinking about, like, while there are a lot of things that we can't control, what are the things that we can?
Any other questions before we think about wrapping up? Okay.
I have one last thought, is that a lot of kids are going through kind of a grief process right now. They may not have actually lost any loved ones, but they're going through the grief process of losing their regular life and maybe even losing their ability to attend graduation or attend some of these end of the year school events. And so grief really is just about loss. And we think about it in terms of death, but it could be loss of the lives that we were expecting to lead, and recognizing that that's totally okay and normal, and thinking about, you know, what are the things that I'm sad that I've lost, and what are the things that I still have that I can keep despite the loss? Well, I'm so happy to have everybody join me, and happy to answer any further questions. If you'd like to email me, allison.libby@ucsf.edu.
Great. Thank you so much. This was such a wonderful and rich presentation. And like we had said, it's going to be available on the website in the next little bit. And meanwhile, for anyone who would like to receive CME credit, please return the completed evaluation form to Nathan Phillip, whose email is attached to the invitation, by end of business tomorrow, Friday.
Thank you, Allison.
Thanks, everybody.